there's different perspectives to it, but I think especially when it comes to healthcare, whether if it's the most vulnerable people or whether if it's for the people who doesn't know how to get access to it, I think maybe in this case, a universal healthcare can be beneficial because especially like healthcare that we look at here just in the state of California, there's different healthcares that we are taking cover into. And there are so many healthcare insurances and people get confused at this point because based on if you want to go to this doctor, you have to go to this clinic, this department, and you have to use this insurance and some other insurance for this medical hospital might not be valid because it's only accepted here. So I just think like that whole complicated process is what makes people so frustrated because
Yeah.
if you're really ill and if you need like an emergency surgery, people would probably not want to be going through that, especially if they're the one going through it and then other hospitals not accepting them because they don't have the proper insurance. So I feel
Yeah.
like in that case, if we just had one health insurance that kind of covered everything, but of course in the United States, that's kind of hard because of how big our country is. But I think maybe if state governments can just focus on those kind of aspects just for the state people, maybe that might be a different or better approach than just the federal government just telling people what to do and be like, well, this is insurance for Medicaid, Medicare, we have Blue Shield, other cases like that. So I think if state governments can kind of provide their own state insurance, I think that might be helpful for a lot of vulnerable
Mm.
people.